Good morning, good afternoon. My name's Tori James. I'm working for AMREF Health Africa Tanzania as a program lead for water, sanitation, hygiene, and climate change. I'm privileged to share with you a few lights of the work that has been done by AMREF Health Africa Tanzania. In particular, the project, Takanimari project, which will be our case for discussion. AMREF has been on the ground for the past 60 years, and it aims to bring the lasting health change in Africa. Last year, AMREF Health Africa Tanzania launched a new strategy for 2023 and to 2030, which goes in line with the SDG. In the strategy, the focus is to catalyze and drive community-led, purpose-centered health services while addressing the social determinant for health. Social determinant for health comes strongly now because we wanted to make sure that the poor, marginalized, the last miles, and the hard-to-reach people, they have access to water, sanitation, and hygiene. We equip them with the right economic empowered support, and also to ensure that the climate change effects are well adapted and the mitigations are developed for them for resilience from that effect. So the AMREF went to attain the universal health coverage through public health security and emergency health threats be addressed adequately, but also to transform in data and technological to deliver health services. As I said, we are grounded within the community. We are working with the government, and we are leading and facilitating the process towards achieving the last health change in Africa. So I will discuss with you on the waste to wealth, circular and climate change mitigation and adaptation in Tanzania. A case of Takanimari project in Dar es Salaam, Tanzania. This will be under the theme of climate change adaptation. We have used the circular economy as a means and approach to climate change mitigation and adaptation. I will introduce the project very brief. We'll see the circular economy, why to circular economy as of now. We're gonna see the agent for circular economy, the market and the behavior change approach are the means to drive circular economy, the economic transition opportunities, achievement, and we're gonna have a few questions, 2 questions for discussion. This is Dar es Salaam. Within Tanzania country is one of the region which is harbored by Indian Ocean. It has 5 districts, as you can see, color code districts. And we are operating in this district. It's called Ilala, which is the central part of the city. As I said, the project has started in 2018. The aim is to improve the community health as the key target, but also to increase income, as we said, the social determinant for health. Importantly, is to see the mitigation of greenhouse gas emission through using of charcoal as alternative energy, cooking energy for the people. Our focus is on the waste minimization. As I said, we are addressing a number of SDGs, including the clean cities. We focused to advocate for reuse, product reuse, but also recycling, as we are setting and we are preparing the so this is the why circular economy. As I said, a circular economy means to make our planet safe and livable. We also need to promote prosperity of our people. Our people need to increase their well-being, human well-being. A circular economy is a path to sustainable development goals. We have seen that almost nine goals are being addressed by circular economy interventions. Goal number 3, number 6, number 7, 8, 9, 10, 11, 12, and 13. They all fall and can be adequately addressed by the circular economy approach. What is the urgency for circular economy now, especially in Dar es Salaam, Tanzania? We have an alarming situation. Last year, we conducted the national census, and the data shown that the population for Dar es Salaam only is more than 6 million people, while the country has a total population of 62 million people. The growth rate is also very high, 4.2% per annum. The waste production is very alarming, 10% per annum. And as of now, we are producing more than 11 tons per day. 70% of them is informal settlements, where people, marginalized people, last miles, women and youth, unemployed people, they are constitute almost 70% of the total population in Dar es Salaam. Unfortunately, the total waste that are produced in the city, only 50% can be collected and transported to the dumping site. The bottom line figure indicates the majority of the waste that are produced in Dar es Salaam are kitchen wastes or biodegradable wastes, which are can be converted into other energy recovery systems. So AMREF, in collaboration with the government, sat down and analyzed the situation, thought through what can be done, mapped out the area that were potentially haphazardly and prone to communicable diseases. We cited 4 wards within the slum that were recurrently recording the communicable diseases, including diarrhea and the others. So we sat with the government and private partners to discuss. We saw the cooperation, collaboration, and the coordination modalities, how to participate each other, how could we participate. And also we saw the policy, law, institution, and the cultural processes. How are these enabling or this enabling environment can be contextualized to the effort that we are putting forward. So we also thought how the facility, if we start this circular economy at the facility level, how this product will be available. Are they really be available any time that are needed by the community? Will they be affordable? Affordability? The product that will be cycled will be affordable? Will they be accessible to all people whom we are targeting to? Durability, preference, and sustainability were also taken care of. We also contextualize around knowledge management. How will we share the knowledge? How will we generate the knowledge? The knowledge for whom? Whom we want to change? Who is the target knowledge broker? So we designed the message. We included the media team through the channels, radio, TV, and others, social media. We also brought the knowledge advocacy, brokering. How can we broker the knowledge and make sure that people are aware and the awareness are raised on the circular economy? Because otherwise, they will not be able to take up. We saw the regulatory framework and the management, the enforcement, the monitoring, sanctions, and the reward and the compliance. How can we make this regulatory management to be working in this context? So the aim was to change the behavior. As I said, this is a relatively new approach. People need to understand, clearly understand. People need to clearly change the attitude and the behavior. People need to clearly engage and do practice right from the point of waste generation. But also want to see the outcome. Importantly, the feedback, how these people will be fit, and make sure that there is a continuation, a sustainability, and the change can be weighed and seen. So this is the opportunity that we have created on the ground. We have worked with the 4 communities in the slum to start with as a pilot. We have supported the entrepreneurship group of women and the youth with facilities. We have linked them with vocational training, local vocational training within the country to support on the technology development. We have linked them with the financial institution to support on the financial systems and management, how they can manage their incomes. We have linked them with other NGOs who are interested to scale up the interventions. So we have looked in totality how to foster greener and a more resilient value chains. So they are producing, some people are coming to take up their product, others are producing, others doing supply. In those value chain, how can we make sure that we work together, we cooperate together, and make sure that we are ahead of the game? The protection of the nature is the key. The resource becomes scarce, biodiversity loss, and the climate changes. There is now high flooding, long dry spells. How can they work on that? But also the job creation. We have tried our job best to increase the women and the youth engagement in this business. They are now coming together. Yeah, so we also put the effort on the elimination of pollutions and make sure that revenue are created. As you see, this is the Minister for Community Development, Youth and the Women in Tanzania. She was able to visit the group, and she has a talk on how to improve the business. And this is the achievement that we have at least reached in the past 5 years. We have made less waste in the street. Now, if you go to the street, you cannot see waste scattering. Now they have all been turned into products. You see the product has been made. Now the group can produce 384 tons per year of the charcoal alone. You see the people are now engaged, business has been created, people have been engaged, now they're no longer going to street and they do other unlawful businesses. And the bottom figure indicates the revenue that has been increasingly by the group and how the briquettes have been proved that they have more energy calorific value compared to the normal charcoal, in which 70% has been saved by the women and the youth who are doing the food businesses in the streets. So two questions: how can we improve demand and market approach for circular economy? As I said, it's a relatively new business. We need more people as the government enabling environment is conducive. Government is very supportive and the players are on the ground. Yeah, so another question is the partnership that we can take forward, because we still have a lot to work on. We have only one project and we have many cities having the same challenges. We have the new regulation for solid waste management that need now the entrepreneurship approach, and we need more resources to streamline at the community level so that these people can also be much benefited and access to services. Thank you very much. I submit. Thank you for listening and have a good day.